We are now joined via Skype by Janet Cherono, who is a program manager for the Norwegian Refugee Council in Maiduguri, the capital of Borno state in Nigeria. Janet, good evening and thank you so much for joining us on the Globe. Now, what's the situation around the outbreak as we speak? What do casualty numbers look like?
Okay, so there has been a dramatic situation in terms of the numbers that have been reported for the ongoing cholera outbreak. The current numbers stand at 10,405 individuals affected, and we have 175 people already reported deaths from the three states of Borno, Adamawa, and Yobe state. This is a situation which could normally be controlled if effective treatment and timely provision of sanitation and water facilities was done on time. But this has not been the case. And with the coming in of the rainy season in Borno, which kicked in around the August of this year, the conditions in the camps has worsened, and this has precipitated the outbreak. So over the last period of 2 months, we have over 10,405 people to be precise. And these are high numbers compared to last year's outbreak.
Now, Janet, who do you find are the worst affected targets in communities?
Okay, the worst affected targets in the communities are children below the age of 5 years. And we have those communities that are living in the congested camps that have been affected severely by the ongoing outbreak. In one of the local government areas here, which is within the Maiduguri and the Jere local government, we have high numbers of IDPs, and you find that we are still receiving cases from these camps.
Now, looking at the areas that are seemingly most affected, for instance, Adamawa and Yobe and, Borno, where you have requested as the NRC for them to come up with solutions with regards to the cholera outbreak, which they seem to have a problem with on an annual basis. And as you've mentioned already, that children are the most affected. What is it that they're not doing correctly or are not getting right with regards to dealing with cholera outbreaks in the country, especially in those areas?
So the major issue is the provision of land for construction of proper sanitation facilities. As at the moment, we have some of the camps that are overly congested, and these camps are usually within the confines of the local authorities' headquarters. So the first thing that has been the problem is provision of adequate water and sanitation facilities. And then the second thing is an issue of operation and maintenance. And then the third issue is that there has been an issue of sustainability, especially for the facilities that are provided. If you look at the statistics at the moment, we have around 46% of water points that are not functional. And as you know, provision of adequate and safe water, provision of proper sanitation facilities are key in ensuring control of future outbreaks. So if these issues are not addressed, then we are steering into another year of cholera, 2019. The situation last year was better than this year. So if these issues are not addressed on a timely manner, then we are likely to have more cases reported in 2019.
What are the biggest challenges that the NRC is faced with regards to the outbreaks?
Okay, one of the challenges that NRC is facing with regard to the outbreak is availability of space for construction of proper sanitation facilities. And congestion in the camp, as you know, cholera is a communicable disease where people are cramped up in small spaces. The likelihood of it spreading faster is very high. And the other issue is that NRC is facing in regards to these outbreaks is access to some of the areas that are not currently accessible. And the other thing is that improved healthcare that the Ministry of Health is supposed to look into. As you might have heard, last week, the president of Nigeria has declared a state of emergency in terms of provision of wash services within the country, and it has made a commitment to implement the National Action Plan. As it is right now, the president has described the state of water and sanitation provision in the country as very disturbing. So it is something that both NRC, the government, and the other humanitarian actors are looking at moving into 2019.
Now, looking at water and sanitation problems within Nigeria, and the president having highlighted these issues and the problems that the country is facing, are there any indications with regards to timeframes and when expected action will be coming forth from government?
With the declaration from the president last week, action was supposed to take effect immediately. And in terms of the humanitarian actors, we are also looking towards the beginning of the rainy season in the Northeast, which is usually the cholera season, sadly, to be able to address all these cases. So it's both the government, the humanitarian actors, looking into proper measures to control future outbreaks.
Now, Janet, what's the biggest challenge that the NRC is facing? Other challenges apart from what you're looking at with regards to the cholera outbreak and dealing in conflict areas within Nigeria?
Yes. So one of the other issues is that NRC has not sufficiently mobilized for enough funding to be able to handle this issue. So with this, we are calling on the international donor community to support the humanitarian actors in the Northeast with enough funding to support cholera prevention moving into 2019.
Janet, with regards to funders and speaking to other actors who are working with the NRC in different conflict areas, do you think that there's a big problem with regards to donors pledging and giving through the pledges that they make to the different humanitarian agencies with regards to assistance? Is there too much going on in the world with regards to donor funding and what is required?
Okay, in terms of the situation in the northeastern Nigeria, there are two aspects into it. First of all is the availability of donor funding, and the other one is to be able to set up the facilities to meet the international standards. So the donors are very much willing to support the response in the northeastern Nigeria, as in the other countries in the world where NRC is working in. But the call, as well as I mentioned earlier on right now, is for the government to support the humanitarian actors in Yobe, in Borno State, in Adamawa, in providing for space for agencies to be able to do a meaningful response in terms of addressing the issues that has led to spiraling of cholera outbreaks year after year.